Hi, everybody. Welcome to the World Hepatitis Day webinar. And I'm just going to wait a minute and let a few people come in before we start. Just give it 1 minute to let everybody come in. Oh, fantastic. The numbers are still going up. Steve, we have something funny on the front slide. Hi, Mohammed. Okay, it looks like the numbers have slowed down. So I want to say welcome and thank you so much for joining us this morning, this afternoon, or wherever you are. Oh, there we go. The slide's better now. And welcome. So this is our third in a series of Let's Break It Down webinars each year. And I think just to give you, hi, everybody joining. I love the fact everyone's going into the chat box. Brilliant. Just to give you a little overview, just a quick introduction. Same as ever, if we can move to the next slide, please. This is our community forum, and I'm actually really, really happy to be here and chairing this. It's a real privilege to chair this session. Same as ever, we do have interpretation. If you look, hi, Louisa, at the bottom of your screen, you'll see there's an interpretation, there's a circle there. Just tick which language you would like. I would just say, please, if you do, because there's an opportunity at the end of the presentations for you to put your hand up to ask a question or to just make a comment. If you do speak, please speak slowly or not too fast so that the interpreters are able to translate for you. Brilliant, thank you. So, as I said, welcome. And what we've got today is a little introduction. I'm going to ask where we'll have our panelists who will introduce themselves. I'm going to talk a little bit about stigma, and a lot of this is about stigma today. We know that stigma is a massive, massive barrier to elimination. I'll talk a bit more about that in a minute. Then we'll hear from our guests, our panelists. I do like the word guests better than panelists. And then there's an opportunity to ask some questions. If you have questions that pop into your head and you think, oh God, no, I'm going to forget it, put it in the Q&A box, or you can use the chat box. Probably easier for us to pick it up if it's in the Q&A though. So next slide, please. And it gives me great pleasure to introduce to you our guest today. If you'd like to introduce yourselves, that would be fantastic. Supa, would you like to introduce yourself?
Of course. Thank you, Rachel. Thank you, World Hepatitis Alliance, for having me here today. My name is Supa Chantschool. I am in the UK and I am the CEO of HepB Companion. I am also living with hepatitis B.
Welcome, and thank you so much for being here. And then Karen, who I don't think needs a lot of introducing, but most people know who you are. Karen, over to you.
So I'm Karen Hoyt, and I'm a hepatitis C survivor. This is my 15th year since my diagnosis, and I'm a liver cancer survivor, and I received after hepatocellular carcinoma, I received a transplant. Glad to be here today.
Welcome, and I'm really happy to have you here today as well. And I think, is Chester here yet, Toby?
Yes, he is.
Ah, Chester, would you like to introduce yourself?
It looks like Chester's microphone might have an issue at the moment, but I'm sure it'll connect shortly. So maybe we can come back to Chester.
Fantastic.
He is with us.
Okay, Chester, we'll come back to you when your mic's sorted. Brilliant. So welcome to everybody. So I think I just wanted to quickly say, I mean, I think we all know each year more than 1 million people lose their lives to hepatitis, and the number of deaths is rising. You know, and it's insane, but why? You know, we have fast and accurate tests, effective and affordable treatments, and a proven vaccine that could prevent 95% of newborns from getting hepatitis B. And we know low awareness, misinformation, myths and stigma are stopping people from accessing hepatitis services. And there's leading to a lack of action by decision makers. We all know that stigma is an enormous barrier to elimination, and we know that actually even, you know, the World Health Organization acknowledges this, you know, in as much as that there is a target, you know, within the elimination goals around stigma. So it's highly recognized. So this World Hepatitis Day, let's break down the barriers. Let's have this session, the barriers that are holding us back from a hepatitis-free world. That would be, I can't get my head around a hepatitis-free world, but let's look at the barriers. Anyway, so what I'm going to do is just, next slide, please. Just going to talk to you very briefly about a little bit of work that we've done at the Alliance. So you'll know over the years, we've done a few different reports in terms of stigma and discrimination. Going back to 2016, 2017, in 2021, we did a report on hepatitis B, which was around people's told through people's lived experience. But more recently, you know, because there is a real lack of data on stigma and discrimination, which is related to hepatitis, that we, alongside ECDC, pulled together a survey in collaboration with people with lived experience to measure the stigma and discrimination that is experienced by people living with viral hepatitis. So, and what came out of this was, I don't think it will be any surprise to anybody, 48% of those affected by hepatitis C said that they had poor or low self-esteem because they were living with hepatitis. 1 in 6 said that family members had made discriminatory remarks about them, and 1 in 10 of those living with hepatitis B had been threatened, verbally abused, and or physically harmed by a sexual partner. And every time I read this stat out, it's just absolutely shocking that this is because we know stigma is a thought, discrimination is an action, and it's misinformation, and it's absolutely outrageous. Next slide, please. Other data, other findings that we found, 57% of those affected by Hep C and 46 of them with B found it difficult to tell people. No big surprise. I know, myself, and I didn't introduce myself as a Hep C survivor as well. The difficulty in telling people and how that made you feel. 70% affected by C and 44 by B had concerns that they could pass it on for others. And that's about misinformation, which is just insane in this world that we live in. And 7% of those living with hepatitis B and C said that they'd been denied employment or fired due to their hepatitis status, which is just totally unacceptable and I think probably illegal. Next slide, please. Just finally on the end here, 34% and 25% respectively, hepatitis C and B, had been worried that they would be treated differently by healthcare staff. This is one of the biggest things that comes up, and it's an enormous barrier, is that people's fears of how they're going to be treated or how they are treated by healthcare practitioners. And then the percentage of those, 24% and 15% that don't go to healthcare services when they needed to because they expected to be treated differently. I know from my own experience, and I say this often, going to the dentist, I was always put on the end of the list. And, what happened in the end was I stopped going because I was treated so badly. The shame that I carried was appalling, so much so that I lost all my teeth. But anyway, I'm sure that for many people, there are very similar stories. Is there a next slide, please? So yeah, if you would like more information on the report, and I guess just to say about that report was a pilot survey. So we only did that across 8 countries and they were based in Europe, Eastern and Western Europe. We would love to actually do this a broader across the globe survey and have a website where this data could be held. There is an HIV stigma index. We need a hepatitis index. So if any of you know of anyone who's willing to sponsor or support it, please push them our way, because we'd really like to broaden that out. Because if we cannot get this measurement and policymakers, our governments, to understand the impact of stigma, we really, really are going to struggle to eliminate. So moving on, how does stigma and discrimination impact on your life? And how can we overcome it as individuals and as a community? And I think that quite often we get people ask us questions and they say, oh, what can you do to change it? And I don't think it is all about us changing it, but we have a role to play. I think it's external because it's about how other people behave and how other people think. But what's really important for us as a community is how does it impact on us and how have we overcome it? So I'm actually really thrilled that we have our guests today that are going to share their experience of living with or being affected by hepatitis B, hepatitis C, and they're going to share their experiences. We're then going to open up for a Q&A, or as I said earlier, it could just be a comment, you know, a comment that you want to make about something you've experienced in terms of stigma. But enough from me. I'm going to hand over to Supa. It gives me great pleasure to introduce you to Supa. Yeah, your experience is Supa.
Of course. Thank you, Rachel. So I want to take you back to 1998. So at the time, I was 8 years old, and my family was planning to go on a holiday, as you do for the summer. So they took me to the GP, our family doctors, just to check my vaccinations, get any boosters I needed. And I thought, fine, we're going to the doctor. It's pretty simple, pretty standard. But then over the next couple of weeks, we were called back a second time. This time just to get my blood test, check if I developed the antibody for any of these vaccinations. So I didn't think much of it as well. You don't think much of this as an 8-year-old. You just go in for the free stickers and sweets to give you afterwards. But then they called us in for a third time, and this time they sat my parents down and said, "Your son has hepatitis B." So as you can imagine, my parents were a bit shocked. They've heard of hepatitis B before, but they heard of it from people back in Thailand and Vietnam as from risky behaviors, eating seafood, and it's really always been associated with kind of just like a dirty lifestyle. So they were wondering, how did I have it? So similar to the pandemic, we had the whole family tested. So that's my parents, my mom, my dad, my brother and sister. Then we found out that my mom was also positive for hepatitis B. And again, she didn't know about this. She's never encountered it before in her life. But then there was that, like we had hepatitis B now. And ultimately, in 1998, we weren't given much information about it because the GP didn't fully understand the condition themselves. So things changed after that. We came home, and coming from an Asian family, my mother, when she married my father, she moved into my father's family home, as you would do in our culture. And knowing that I was a kid with hepatitis and knowing that it was likely contracted for my mother received quite a bit of pushback and animosity from my dad's side of the family. They think that she was partaking in risky behavior. They think she was eating raw shellfish, which we know that isn't the case in hepatitis B. You don't get hepatitis B or C from food. So growing up, I could see that there was a lot of pushback on my mother, which then kind of led on to me. Soon after that, I was told that I had a distant uncle in Thailand who also had hepatitis B, but because of his risky behaviors, no one in the family speaks to him. So hearing that as a kid, you automatically already think, oh, I'm going to grow up and my family's not going to like me because I have this condition. So because of that, I became quite closed off growing up. So through my teenage years, I would go to school. I wouldn't tell people that I had hepatitis B. I just wouldn't talk about it, but I could feel that I was putting a wall up around myself. I was really trying to not let people get close. And it became a problem because ultimately I was too shy to go up and talk to anyone new. And whenever somebody would talk to me, I would almost had to like think for a second. I was just like, oh, somebody's talking to me. What do I say? I was a bit lost socially growing up. And it didn't help that I didn't know anyone else around me who had hepatitis B apart from my mother. And even then, she didn't really understand the condition herself. So getting into college, I was meeting friends, getting to know other people. But the one thing which I stopped myself from doing quite often was dating. I could see all my friends were going out with different people, male and female, and there was almost like a mental block for me to be like, oh, I shouldn't date anyone because I might pass hepatitis B onto them. So I just took a step back and I just really just tried to be on my own, which left me to be quite isolated for a while. And around when I was 16 years old, during that time, I was being seen at a hospital by a liver specialist in the pediatrics department. But soon after I turned 16, 17, the letters stopped coming in. So at the time, I didn't think much about it. I thought, maybe it's cleared by itself. Maybe they didn't need to see me anymore. But looking back now, I realized that I was being transferred from the pediatrics department to the adults department, and I was lost to follow up by hospital. But it didn't affect me at the time because I had exams, applying for university, trying to sort out my social life or the lack of my social life. And it was only when I got into university, I decided that, I need to do something over the summer holiday. So I decided to go to Honduras to do some volunteer work. And I was told that I needed some boosters and vaccinations to go to Honduras. So that's what I did. I went to the GP, I got myself vaccinated, and I just told the practitioner, I have hepatitis B and I'm not being seen by a doctor at the moment. So they were taken a bit aback. I was like, oh, but you have this condition. You should be seen by a doctor. You should be monitored quite often. So they referred me back to hospital. It was only then when I met my doctor in hospital, the consultant liver specialist, that he really took his time to really help explain to me what hepatitis B is, how it affects people, what I should be doing, how I should be responsible of my own condition. I should learn about it. And it was only then I realized that, oh, so this condition is actually you can live with it for a long time. It doesn't, if you keep it monitored, it won't develop into anything worse. So that's what I did. I studied biomedical science. I decided that I want to go into research. I want to go take a look into hepatitis B. And after finishing university, that's what I did. I applied for a job and I was looking at clinical trials in infectious diseases for so many years. It was only when I really started to understand that I went through this journey of hepatitis on my own. I didn't have the support which could have really helped me throughout my journey. And the kind of stigma that I had around myself was really blocking me off in terms of career, in terms of social development, and just in terms of really just getting on with my life. So in that sense, the stigma really did affect me growing up. In terms of the discrimination, I mentioned before, there was a lot of occasions with my family where I felt like I was being discriminated by them. But I guess one of the worst situations I come across was when I was in a pool with my cousins when I was younger, and my nose started bleeding. So my cousins all just jumped out the pool saying, "Oh no, your brother's dangerous, your brother's infectious. I don't want to get it," and everything, not knowing the repercussions, not knowing how that would affect me and my development growing up. So fast forward to today, we are now in a very exciting place where hepatitis B is getting the spotlight. Has been developing for a very long time. We have been on the coattails of HIV, Hep C, and other conditions for a very, very long time. And it was only when last year where the preliminary reports for the ED testing in the UK came out, and we realized that there's a lot more people living with hepatitis B than we thought. And now these people will go through a similar journey to mine of living with it, having to tell their families, having to tell their friends, and potentially having that stigma, potentially getting that discrimination. So that's why we created HepB Companion. We want to be there to help people go through this journey and really support them along the way. Thank you.
Thank you, Supa, and thank you for your honesty. And I'm sure there will be people here that can relate to everything that you've said. I'm going to hand over to Karen now. And you're not going anywhere, Supa, are you? You're going to stay with us, yeah, so we can have a bit more discussion. I'm going to hand over to Karen, who's going to share some of her experiences and views. Yeah, over to you, Karen.
Thank you so much. That was really, can you hear me okay?
Yeah, we can hear you. Brilliant. Thank you.
Great. Well, good afternoon, good evening. I'm from Oklahoma in the United States, and that was really a moving story. I think every patient's story of stigma is very heartbreaking. It's hard for me to talk about even all these years later, but I'm Karen Hoyt. I'm a hepatitis C survivor. And when you think about, I like to speak to patients when you first are diagnosed and you find out what it is, you wonder what's the worst that can happen? What's the very worst that could happen? And what's the scariest parts? And for a hepatitis patient, I think it's like, well, what if I have the variceal bleed? Those can kill you. Or what if I end up with liver cancer? That's a killer. Or what if I have to get a transplant? And I went through all of those. So I like to think of my story as a story of hope. If the worst can happen, it's happened to me, and we are survivors. And I like the word survivor because we can survive. But when I was first diagnosed in August of 2010, there wasn't a cure for hepatitis C at that point. But I did Google and find out that that was the first year we had a global World Hepatitis Day. I believe the very first official where everyone united, and the WHO came in, and it was the first one. So we're celebrating 15 years. And at that time, there was no cure. There wasn't a lot of information on the web. I did declare, I'm a teacher, and so I declared that if I could get through this, I would find a way to put information on the web so that no one would feel as alone as I felt that year. For many years, the virus was silently attacking my liver, and I didn't know it. I was almost 50 when I was diagnosed. I think I was right at 50. I experienced this subtle burden that took over slowly. Of course, it's the silent disease, but I think my stigma and my self-stigma started long before I was diagnosed. And so that's kind of a new angle at it. I'm looking at hepatitis patients. And, you know, we talk about I saw one of your memes this week that said, the hepatitis is the second deadliest virus after COVID. And everyone was shocked by COVID. I know the moment I woke up, I knew I had COVID. My body hurt all over. I couldn't get out of bed. This is it. This is what it feels like. We don't get that feeling with hepatitis. That's why when we wake up, I didn't know I had it. I didn't know I had it for 30 years. I lived with it. It just came on so slowly. And so there was no amount of sleep that could fix it. Slowly over the years, the body aches. You know, I'd never lived in another body. I grew up in this body, you know, like he was saying, you grow up with this virus and you grow up with your bones beginning to ache. By the time I'd hit what should have been my 30s and my healthy years, I was probably working into stage 2 or stage 3 cirrhosis. And I didn't drink. I didn't know why. I was just not feeling good. Every simple task was like climbing a mountain. So I had all these workarounds. I wore a mask of normalcy, and I'm wearing it today. It's something that's really familiar. I love to be with other patients because we can take off our mask. But I was trying to hide the fact that my mind was slipping. The hepatic encephalopathy was one thing that was creeping up, and that wasn't even talked about after my diagnosis. They gave me a bottle of medicine to take, but I didn't even understand that I was slowly losing my mind too. I was just living in my personal la-la land, trying to keep up appearances while my body and my brain. So it's a double organ failure. So I like to say to every patient who has hepatitis, we don't know what it's like to live in a healthy body. And I think we need to accept and grieve that. I've never lived in a healthy body since I was probably in my late teens or early 20s. I didn't know what it was like most of my life to have a brain that worked efficiently. I was fighting pneumonia and toxins with a burdened liver and didn't know it. And so when we live so long with this burden of liver disease and the double burden of brain disease, we become a faker. So I faked it to my doctors. I faked it to my boss. I faked it with my kids. It was this hidden struggle that I was constantly trying to perform and to keep up. And I was doing it alone in isolation. We all use the term, that term isolation to describe it's a very alone place in our mind. And so we see other people making it in life. I see other moms, other wives, other teachers. And so I just kept getting up and doing what everyone else was doing. But then behind the scenes, I had sticky notes all around my computer at work. I put a big file cabinet next to my classroom door so that no one could see in the window. And during my planning periods and during my lunch break, I would stay in my classroom and lay my head on my desk and just sleep. I kept a towel in there. And that, that closed door is kind of like what we're doing emotionally too. Now, cultural stigma is definitely real, and it's something that even family systems keep going. Whether it's hepatitis A through D, E, in my family, my father was an alcoholic. And so my mom battled depression because of that. And so I learned as a kid, you keep your troubles behind closed doors. Don't air this out in public. We might have a big show out at our house on Saturday night, but you get up and you go to school and you put on a front for the neighborhood. Well, when you're doing that in every area of your life, I moved into adulthood. I knew how to hide my troubles. I knew how to hide my lack of ability. I was working twice as hard as my peers at work. I was working twice as hard as the other moms and didn't know why. I kept showing up at my doctor's office. I would pull over and sleep in my car. It had reached the point where about the past 5 years before my diagnosis, I was sleeping in my car on the side of the road. Often there was something inside that knew that wasn't right, but I would go pull over and go to the emergency room. So I lived in rural Oklahoma, and it was an hour into a big town, but I would go to these rural emergency rooms and I'd say, well, I'm sleeping in my car, and for some reason I'm just real sleepy all the time and I don't know what's wrong. I'd love to go back and get those doctor's notes now. I'm sure I look like a hypochondriac. They put heart monitors on me. I had so many tests done, and all of it came back, well, she's depressed or she has menopause or some, they were blaming it on something else. But because I look like this hypochondriac, I carried a giant bag with me, trying to keep myself organized. I used a lot of planners, but that internal shame kept me from really seeking the help that I needed. But I will have to say my liver enzymes showed up normal throughout that whole time. So, I mean, I just presented well, and my liver enzymes always presented well. So it all kind of came to a head in 2010. So I had recovered from a stomach bug. By now, I had lost my marriage. I had lost I was getting ready to go back into the classroom, but I'd lost my job. I was unable to show up in life the way that I had been showing up. And it was all kind of falling apart. No one really knew why. And the self-stigma was at an all-time high. But I went cycling along the river. I went and rode my bicycle. Through this, I thought, well, just try harder, be healthier. So I was a health nut. I ate like a health nut. I was a runner. I was a cyclist. I was outside every day. I looked really, really fit. But on this particular day after I cycled, I came home and my feet swelled double. My belly went out like a 9-month pregnant, and my eyes turned yellow. And I had to go to my primary care doctor, who then said, wow, I don't know what's wrong with you. I'd gone annually for all my blood work. Everything had been fine. But I was told then at the hospital, I had my insight. I want to make this point. My insight about hepatitis was so poor that I pulled my IV and ran out of the hospital. I said, you have mixed up my records with someone else. They said, no, you have advanced liver disease and you need a blood transfusion and you need to get this drained. My insight was so poor that I accused them of messing up my records. My family had to drag me back. And it sounds insane now, but I think I want patients to know that if someone's offering you a caring hand, if someone's offering to hold your hand and help you to get the medications you need, or if you're the person that's trying to help a patient understand, you might consider that this lack of insight could be not just from the liver disease itself, but from the mental component of having a serious, serious life-threatening virus. And so after I finally ended up going back in, I said I'd had a stomach virus and I was away from my family. I told everybody, stay away. I can't even hold down red Jell-O. Turned out I'd been throwing up blood for 2 weeks. So by the time I landed in the hospital in August of 2013, I was told that I wouldn't live till Christmas. And my grandkids got up in the bed with me and we really thought this was goodbye. When I woke up with COVID, I knew immediately something was wrong. When I woke up with hepatitis C, I didn't know for 30 years. And so I think we're silent because of that stigma. We stigmatize ourselves. We deny that hepatitis is even serious. We need the compassion and clarity that we can get from those who care. And so to the patients, I would just say, if you've got a caring caregiver around you, my doctor, of course, I was so advanced, there was no drug to treat at that time. And my doctor, once he finally got it through to me, you have a virus and you need to learn about it. Then they sent me to a transplant hospital and where I was too sick for transplant with the hepatitis virus. We didn't have a cure at that time, but I was able, the next year, the FDA approved a triple treatment, which I took for 48 weeks, the interferon and the protease inhibitors. And so then after 48 weeks, I was able to be treated and I've been free of hepatitis C for 13 years. But my liver disease was still so advanced. I was never able to work at the capacity that I'd worked before. I had to go to a smaller classroom near a restroom so that I could deal with the lactulose and all of those things that totally, again, there's more stigma that can go along with that. But we need, I'm going to wrap it up here. I'm not looking at a timer. We need the compassionate care. I know many healthcare workers are listening to this, so I've spoke to the patients, but I want to speak. We've got caring people. The World Health Organization, the World Hepatitis Alliance, that are giving information that wasn't available in the beginning. And I would say trust and partner with your healthcare provider, the clinician, oftentimes I felt so low self-esteem. I would go in and I would just talk to the receptionist and I would say, honey, I'm just not feeling good. I've slept in my car on the way here. I'm sorry I'm late. Can you still get me in? She would always be so kind. Don't worry, honey, don't worry. I've gone into the clinic and been so sick, I was just kind of stumbling with HE, and they would put me in a back room and let me take a nap before I began my drive home. I had quite a drive to the city to get treatment. But people worked hard for me. They helped me to overcome the financial barriers. And the financial barriers are many. But when I read the newsletters, all of these organizations that are represented here, you're working hard to make sure that your governments and your social programs are helping the people. You're going into the neighborhoods where they live. You're using compassion. You're using clarity. You're removing those social barriers and the financial barriers and all the gaps in healthcare. It's happening on a global level. I want to say that we can be more hopeful than ever with these medications that cure hepatitis C so quickly. I know transplants are at an all-time high right now, but even getting a transplanted liver with HCV, or I've got one of my closest friends, she's got an HBV liver. And she said, it doesn't matter. She takes her medications every day. It doesn't affect her. Because now, even though we don't have a cure for Hep B, we do have medications that can help you live a life where you can have a radiant future. And I think that's what I want to say on this World Hepatitis Week and for this community. Dismantle the barriers through the testing, of course, the treatment, and then the vaccinations. And I know everyone's working so hard, but I did write a paragraph. I've written notes, but then I get emotional and get off my notes. But I want us to work together to achieve a hepatitis-free world, to liberate the lonely, the people who are living behind the mask, the person who looks very unlovable, but deep inside, they really want you to find out who they are, eliminating their paths to brighter days for all, to ensure that no one ever has to suffer in isolation and silence from an unseen enemy. Thank you again for inviting me today. Thank you all.
Wow, thank you, Karen. Thank you so much. Yeah, I'm actually going to move on to Chester because I'm thrilled that you're here, and thank you for your honesty. I don't think we hear enough about the journey, particularly the journey when your liver is that damaged. My best friend died. She didn't get to the transplant, and I know I lived that with her, and it's massive. It's absolutely huge. So thank you so much. I'm going to hand over to Chester, and then we're going to come back because I'm sure there will be questions. I don't know if you've all noticed. Now I'm muted. Sorry, now I'm not. Are really quite young, and there's something for me around hepatitis B I've noticed. There's a huge youth movement happening, and I think it's incredible. Chester leads the youth movement. So I want to hand over to you, Chester, to share your experience, stigma, discrimination, whatever you want to say. Welcome, and thank you for joining us. Can't hear you, Chester. We can't hear you. Ben, is this an issue on our end?
No, Chester,
Okay, are you
your
able to get?
Ah, there we go.
Okay, thank you very much. Sorry, I'm having challenges with network, but hopefully you can get me. My name is Chimanda. I'm the Executive Director for Youth Movement for HIV/TB SRHR Advocacy in Zambia, and I've lived the experience of hepatitis C. It all began in 2017, where we were hired. I used to perform in a drama group where we used to do poetry and other drama activities. So we were hired by an activity that was organized by Ministry of Health, where we needed to perform drama and everything. So they were doing mobile screening by then in our community. So I was influenced to do a screening on hepatitis, to be specific, and other HIV infectious diseases. That was more influenced by my peers because we were a group of team and we were so excited about everything because we are there for the show. So from there, I got screened and I was diagnosed with hepatitis C. And from there, it wasn't really something that I was expecting. I had little information about it. And from my reaction from the friends, because they realized that I remained for counseling and also for referral process, because they have to refer me, I have to go with someone to the nearest facility, which was Kanyama General Hospital by then. From there, I have to be escorted by a healthcare provider, being given me medicine. I didn't fully understand what was really going on by then, but I followed the process. From there, by the time I realized that I was home with these pills burden on me, and it's clicked now, okay, this is reality. This is reality kicking in. I have this infection with me, and I have to deal with it. And I developed self-stigma because of lack of information, and also my colleagues started distancing themselves. I have to receive a call from one of group leaders from the group that I belong to, where we used to perform drama, that they will no longer be with me because they have to do business. And, they didn't want to have being labeled as a group which is infected with hepatitis. So I was withdrawn from there by I really had a lot of challenges to just understand what was really going on by then. But I was counseled. I went through counseling so that I can be able to get knowledge about hepatitis. And it's really a challenge because some family members up to now, they don't talk to me. They really isolated me a lot. So from there, I decided to get more information about hepatitis. How best can I also just start advocating about it and just talking openly about it? So I formed a group that is called Youth Movement for HIV/TB SRHR Advocacy in Zambia with other colleagues who were very much vulnerable to other infections, including HIV, the infectious diseases around that we were exposed within the community. So we started forming support groups within the community so that at least we can create awareness about hepatitis and other infectious diseases, because the community is not fully aware about this infection, and they really lack information about the infection, because they think that maybe by shaking hands you can get hepatitis, by kissing you get hepatitis. So there are a lot of misinformation within the community. The stigma that I received, I started channeling it, and how best can I help someone out there who doesn't have information about this? How best can I bring that person so that at least on board, so that he can join the support groups that we are forming within the community, so that they can be able to get the right information about hepatitis. From there, I also joined other social groups, and also I got an opportunity to serve under the PEPFAR Youth Advisory Council to represent the marginalized groups, so that at least we can be able to push the policy around hepatitis and other infectious diseases. So mostly my journey hasn't really been that smooth. We had a lot of challenges. Right now in Zambia, to be specific, we don't have frameworks that speak directly to hepatitis, which is really a challenge, because if we really want to push this agenda, we need to engage the governments, the duty bearers themselves, so that at least they can be able to enforce laws and enforce policies that can speak to the communities. But right now we are trying to organize something that will be able to reflect back to the fight that we are doing under Zambia, so that at least we can be able to make sure that at least we push the policies in Zambia that will speak for the community that we serve. Thank you very much.
Thank you, Chester. And I absolutely agree with you. We have to get the governments on board, absolutely, to get the changes made. But we're going to open it up for questions, or if you just want to put your hand up and say something about your experience with stigma or discrimination, or maybe something that you have done to combat it. I think really interesting. I do want to say though that I think it's come up, each of our guests had said something around self-stigma, and I don't think it gets talked about a lot. The fact that, the stigma we carry ourselves. And I think even, I cleared hepatitis C in 2007. It's a long time ago, but it doesn't mean to say that it isn't still difficult, because I have an assumption. I carry that still. It doesn't go. But I wonder is there, anybody who'd like to make a comment, put their hands up? I recognize a lot of the attendees here, and I'm sure there's some quite vocal people here. That if anybody come and join Supa, Karen and Chester in our conversation, or perhaps you have a question for them. Put your hands up. We've got some hands up. Ben, can you see which hand that is?
Yes, we have Mukul Patel. Mukul, if you can just unmute your microphone, you can ask your question.
Hi, Mukul. Are you there? Can you unmute your mic?
There you go, Mukul, you're unmuted.
There we go. Hi. We can see your hand up. We can see you. No. Well, maybe we'll come back, Mukul. If you're having problems with your mic, we can come back. I just wondered, well, I guess, maybe for our guests here, maybe there's something around self-stigma before we talk about other areas, because I do think there are, and that came out in our survey, the impact on the individual in terms of mental health, depression, Supa talked about, you know, kind of that being insecure, you know, and not having great confidence because, you know, lack of information. You know, I guess, you know, what more can we do, you know, in terms of raising, I suppose it's about raising awareness, is it? Or so that the support is there. What do you think? You know, maybe Supa, what possibly would have helped you more?
I mean, I literally just had an encounter with similar thing that happened to that question yesterday. My aunt gave me a call just out of the blue, just trying to find out what I'm doing and saying how I've been. And I told her, like, I'm working at HepB Companion now. I'm trying to help people living with hepatitis B. And she was just like, oh yeah, that condition you and your mom has from eating shellfish and eating dirty food and everything. Yeah. How's that going? And I literally just had to stop for a moment and just like correct her. I was just like, look, you can't catch hepatitis B through shellfish, through foods and everything. And I had to repeat it almost 3 times before she really started to understand it. And this is in Thai as well. So I really had to really slow down and help her understand, like try to educate her that this isn't something that is passed along by by just eating anything. So I think a main part of that is the education aspect. For a very long time now, we have known of the 5 hepatitis A, B, C, D, and E. But even last year, when we were starting up our organization, trying to find anything just on hepatitis B, I found that there was a lot of condition side effects, symptoms all mixed up. So not only is there no clear source of getting clear information on hepatitis B, there's HepB Foundation and a couple of other organizations out there, but it's really hard to just really understand each of the symptoms caused by each of the hepatitis. So that's one part. And the second is just having someone to speak to about it. From our lived experience community, I found that they're all very closed off from their friendship groups. They won't tell them anything about hepatitis. But the moment they come into a room with other people living with the same condition, it seems like they've known each other for years. They've been through the journey. They've really understood each other, and it's almost like becoming best friends in a second. So there is an element of that too.
Yeah, no, I completely agree. I mean, the peer support is what we're talking about, isn't it? Peer support. Karen, what do you think, you know, in terms of that kind of self-stigma?
Well, you know, so I love hearing it from the young generation's perspective, but, you know, coming as a baby boomer into this, you know, and then I go back to my isolation as a kid, you know, me and my sibling group, we thought the other kids at school lived like this, but I'm different because we had alcoholism in my home. And then I just kind of translated any of my childhood trauma right into my hepatitis. It's like, well, everybody else, okay, Rachel, thank you for being transparent. I don't have very many teeth. My teeth, you know, I was having dental problems over and over. It's like, I'm not like the rest of the world. You know, I'm sick all the time. I've got to take more naps than everybody else. I can't remember things. And so you know, you question your intelligence. I get depressed easier and I'm not able to pull out of it. And you think that whole thing of I'm not like them. Everyone else has got the good teeth, the healthy body, the bright mind, and I'm different. So I'm a reading specialist, and I teach people who have dyslexia. It's a big thing too. Anytime we feel different and marginalized, we automatically self-isolate. And then when it has to do with our liver, and I'm calling it double organ failure, you guys. When your liver fails, your brain fails. And then we don't get the insight. And we need these, I'm looking at all these welcomes from all over the world, these great clinicians and health workers from all on every continent. We rely on you to help us rip off our denial. Like you said, you had to say you're at 3 times. It's not always just ignorance. Our brain puts up a wall that just says, no, but we are different. And that is different. And it's dismantling the self-stigma. Does that ramble make sense?
Absolutely makes sense. And I guess, you know, I think, you know, the thing that we haven't spoken about or no one's spoken about is, you know, Hep C is different from Hep B, you know, and the association with Hep C is primarily it's people who inject drugs. in the US, in the UK, in most European countries, you know, not necessarily in Africa, but or some other states, but you know, we know. So there's a different association then. So not only have, you know, it's a very small proportion in the UK, which is infected blood. But, you know, I have a history. I have a history from injecting drugs. That too carries shame and stigma. So that, you know, and yes, there's absolutely, you know, we can all understand that there is behind that. No one, we don't necessarily choose to do that. Some people do, but, you know, it's because of other things. There are other reasons. It's an addiction. So that it's all multi-layered. And then, as you say, you know, the impact then of a liver that isn't functioning, the impact that that has on your brain, which you don't understand, is having on your brain. So then you have a weird thought process, you know, so that it's tricky. I mean, and I guess the stigma, that's about the self-stigma, you know, it's about what we carry. That it's about what we carry. And I guess it's about listening to Supa there, you know, connecting with other people, identification. And then as a group, we then have more confidence in moving forward and educating other people. I just want to come back to you, Chester, because I know that you do masses of lobbying, you know, to educate people, because I think that's a really big, you know, I think I said earlier, you know, there is a part that other people have to pay, but we do have a key role in changing stigma in terms of raising awareness. And I know you do masses around that. Do you want to, I mean, is there something you can say around some of the work that your organisation does in trying to change people's views, you know, and raise awareness and educate them?
Okay, so thank you very much. So I'll go back in 2017, where I was diagnosed with hepatitis C. So mostly what happened was I developed self-stigma. I used to lock myself, blame myself. Why am I in this position? So really, it really became a challenge. Then I remember that, okay, really, healing doesn't take place when I lock myself. Healing takes place when I belong to a community, a certain social group where I can be able to share my experience. So I started now to form groups so that at least I can talk about it more and get more information about hepatitis, so that I can be able to share with someone who is really receiving that burden, who is blaming him or herself having that hepatitis. So stigma doesn't really affect only the treatment access and other issues. It also affects the mental health of a human being. So the mental health usually kicks in because you start overthinking and a lot of things are happening within you. So mostly I took it up and I started forming social groups, which are called support groups, so that at least we can be able to discuss with other peers, form a network within the community, so that we can be able to share knowledge. Right now, I'm also serving under the Generation Mental Health as a fellow, where we are tackling mental health issues for the marginalized community, so that at least we can be able to share our stories and also offer counseling and offer proper information, because what we are lacking at grassroots level is proper information. Light information is really missing at grassroots level. So we are choosing what we call 1x10 initiative, where we are training university students, 10 of them, so that they can be able to form social groups within the university, so that they can be able to discuss issues that are pertaining to stigma, that are pertaining to hepatitis, that are pertaining to HIV. So this is really powerful, because this is a platform for the most marginalized groups, so that they can be able to access the right information and also access the referral if needed to a nearest facility, to a nearest social groups where they need proper services. Thank you very much.
Thank you, Chester. Brilliantly put, brilliantly put. So I guess, you know, just to say, I wanted to say that, you know, the recommendations that came off the back of the survey that we did that I showed you earlier. So we came that, you know, there were 3 key recommendations there. Were healthcare settings must do more to provide a stigma-free service for people living with and affected by viral hepatitis, number 1. Number 2, more efforts are needed to address mental health issues to improve the quality of life of those affected by hepatitis. And more support must be provided to people living with hepatitis who face discrimination in employment and other social settings. So I guess we've got quite a bit of time here. There's a bit more time. I know that Steve is behind the scenes itching to fill in some time to invite some discussion around language. But before we do that, I wanted to ask each of you, our guests, what would be your one thing? You know, we're about to come into World Hepatitis Day. What would be your one thing around stigma? You know, from the one big message, if you could get it into one liner or one message, what would it be? Chester, let's start with you. Sorry. Go on.
The one message that I can say is that stigma is not something that usually it's not just a barrier to treatment. It has a lot in it, because there are a lot of issues that are coming out. There are a lot of structures that are acting as a barrier in terms of accessing treatment, for example. So it's not really a fight for people living with hepatitis. It's a fight for all key stakeholders, including the government, including the church. They need to come on board so that at least we unite and fight stigma. Because if a person is having self-stigma, that person is lacking information, first of all. If a person is stigmatizing the next person, that person is lacking information. So let's offer information to these key stakeholders so that we can unite at the end of the day and fight the stigma. Thank you very much.
Fantastic, thank you. Karen, there is actually a question for you, Karen, as well, that's just popped up. I don't know if you want to answer the question first and then give us your one, if you're happy to do that.
I'm happy to, I can't see the question.
So it's did any of you, or I mean, it's anybody, did any of you have extrahepatic manifestations?
Well, for me, not, so I had, yes, gosh, I had ascites. I had to have, I had to have a lot of paracentesis, where I had to have my belly drained a lot over the year. And then while I was on treatment, I had to have a lot of blood transfusions. They just scheduled a varices banding because I was throwing up blood. They scheduled my bandings every 30 days. I just went in and got banded just to prevent bleeding. A lot of medication. And, you know, we could tag on to medication and talk about compliance. You know, I needed lactulose because my brain was gone. I was teaching on a college level, guys, and literally overnight, I'm in bed getting blood transfusions. It can really rob you of everything. But so yeah, and any additional questions about that? I had a lot of extrahepatic manifestations. And then living with end-stage cirrhosis, I had a very small classroom right next to the bathroom for lactulose. And I got tested every 6 months. And sure enough, my liver was so far gone. I got a year and a half, 2 years after I cleared hepatitis C, I did get liver cancer, and then had a year of treatment, and then was able to get the transplant in 2015. I just celebrated 10 years. But back to the stigma. Supa, would you do yours on stigma, and then I'll come back to mine? I had a thought.
No, of course, we'll come back to you, Stu.
So mine is more of a personal message. So I spoke about building a wall around myself, and it's a pretty common theme around people living with hepatitis. The walls are built with bricks that you put down yourself. Maybe it's bricks that have been handed to you by friends, family, communities. These bricks build that wall of stigma. It's your responsibility. It's something where you need to work on those bricks and start breaking it down. This can be with the help of the people around you, people from the community, from family, but at the same time, it's something where you need to take control of your hepatitis. You need to really dig deep and decide that, okay, I'm done living with this condition. I want to do something about it now. It's about breaking that down.
Fantastic. And that ties in brilliantly with Let's Break It Down, because it is all about Let's Break It Down this World Hepatitis Day. Karen, do you want to come back in?
So listening to him talk reminded me. So as a high school teacher, I saw the students as they were getting ready to graduate and move into life. And I saw that they didn't have the skills, and they certainly didn't understand hepatitis. They didn't understand healthcare in general, but they didn't have the skills to know that a lot of what I did as a teacher and language arts teacher was, okay, you can move into life even if you're not a strong reader. You can move into life even if you're not going to college. If you're going to a technical school, I was really big. I worked for technical schools for years. I think that people need to understand that you are worthy of living a radiant life with a beautiful future. We're all born with the ability to grow and change outside of we go back to our original home or our original experience with our peers at school. And then I love to see students 10 years later, and it's like, look who I've become. We have so much that we can become. And I love your work that you said, work hard, find out who you want to be, make some decisions, and believe that you're worthy of love and belonging. Believe that you're worthy to live Hep C free. Believe that you're worthy to cast all that aside and that you can live a bright and radiant future.
Fantastic. That's brilliantly said. Another question has come up. Laudith, would you like to speak? I think you've got your hand up and ask your question, or would you like me to read it out? It's a very interesting question. Ben, is hi. Hi, Laudith. Yes.
Hola, ¿cómo están, Laudit de Colombia? ¿Cómo están? Bueno, yo tengo una pregunta pues que siempre me ha surgido durante tantos años trabajando con hepatitis virales, inicialmente con VIH, desde el 2011 con hepatitis virales. Hablo de mi país, Colombia, que en tantas campañas que nosotros hemos venido realizando, inicialmente pudimos evidenciar que las hepatitis eran conocidas siempre relacionadas con la hepatitis A. Y esto pues inicialmente fue preocupante pues porque sabemos los diferentes tipos de hepatitis, pero más preocupante era que cuando preguntábamos, la gente la relacionaba siempre era con la hepatitis A y su forma de infección. Después me di cuenta con el pasar de los años y con todas las recomendaciones de la OMS y cuando empezaron a emerger los grupos claves frente a los cuales debíamos hacer intervención, hacer detección oportuna, me he dado cuenta que ha habido un cambio positivo en el tema de iniciar detecciones oportunas y trabajo con la comunidad, pero negativo cuando empezamos ya a querer que la hepatitis, a querer sobresaltar y hacer que se hablara de las hepatitis virales, en especial la hepatitis B y la hepatitis C. Pero no nos dimos cuenta, o sea, es muy personal lo que estoy diciendo, no nos dimos cuenta que cuando hablábamos para que las personas tuvieran ese cuidado, esa prevención, esa educación, esa sensibilización, de compararla con el VIH cuando el VIH aún sufre estigma y discriminación, a pesar de que ya ha pasado tantos años, a pesar de que ya es prácticamente, bueno, no quiero decir que ya está solucionado o no, pero pues que ya es un virus que la gente conoce, que se sabe cómo se trata, que ya hay más información acerca de ello y a pesar de ello aún hay discriminación. Entonces, cuando tomamos las hepatitis virales y empezamos a compararla con el VIH, de que ojo, que la hepatitis viral de la B y la C es más infecciosa, es más peligrosa, a veces siento que inconscientemente estamos estigmatizando nosotros mismos también el trabajo que estamos haciendo frente a las hepatitis virales. Esa es mi pregunta. Mi pregunta es, si los compañeros que están en el panel consideran que somos nosotros mismos, las organizaciones civiles, que tenemos una responsabilidad en llevar una información, si somos nosotros mismos que inconscientemente estamos generando esta estigmatización, de alguna manera.
Wow. Wow, that's a big question. I think everybody, any response from everybody would be, and I have a personal view as well, but I'm not going to go first. Who would like to go first? Or who would like to comment on that? Everyone's smiling at me. Maybe don't make me choose. You guys volunteer. Go on, Supa.
Very, very tough question. Yes, in a way, where there is a lot of information, it would bring a lot of questions. And therefore, when there is too much information, people tend to essentially put it on themselves, become quite hypochondriacs about it. And sometimes it puts fear into them. We try our best to keep the information very simple, very brief, and we try to talk to the person rather than letting them read a lot of text on our website. just something where they can just actively ask questions and doesn't cause more stigma. By speaking to someone who is already living with the condition, it kind of takes away a bit of the stigma of just reading it from the internet. But yes, that it is a very tough question, and it is something we have become aware of because hepatitis affects so many people over so many different countries. And even when we do different translations of our information into different languages, we have to make sure they go through someone who is lived experience with hepatitis B, just to make sure that it comes across, it doesn't comes across and causes fear in the person reading it.
Thank you, Supa. Chester, Karen, any comments?
Well, I know what Chester's going to say already, and it's get back to the small groups. And so, so I hope you'll come in and say, but get back to the small groups. When you're in a small setting, when you're in a forum, even if it's an online forum, when you're hearing other people who said, yes, I had this experience. Oh, Rachel, I love you already. It's like, wow, I talked to a lot of people who have lost their teeth, but I talked to a lot of people who threw up blood. And so it's like that, you know, knowing other people that have been through what I've been through and just them saying, I'm alive. And then you look at them and we have this idea that other people are better than us. I'm a language arts teacher. Henry David Thoreau and Ralph Waldo Emerson, we all see the gleam of light that's shining in someone else's life. Oh, you're worthy, you're smart, you're good, you can overcome this. But we can all turn back and push that light on ourselves when we're in this small group, and then we can get the feedback from the community. Yes, and you too. You're worthy, you're smart, you have a future, and then together as a small group. So Chester, go ahead. I know you're going to echo small group.
Chester, are you going to come in?
Thank you. Thank you very
Perfect.
much, Karen. Thank you for adding up. So let me just add what you have just mentioned. Small groups are really important, but also I think we also need to encourage peer-to-peer education, especially so that at least a person can be able to be free to express himself and be able to also see, okay, this is a young person who is talking to me. This person has gone through this journey and he has managed to survive. It really taps a lot of courage to hear it from your fellow peer, actually. So go back to the same group, and also let's make sure that at least we encourage peer-to-peer education within the community, so that at least filtering those small group, we can also have edutainment. There are a lot of lessons that we can get from edutainment, whereby through entertainment, someone can be learning something at the end of the day. Thank you very much.
Fantastic. Thank you, Chester. And I just wanted to say on the end that you Lourdes, you spoke about HIV, you know, and viral hepatitis is a poor relative to HIV. You know, I mean, I think there will always be comparisons made, but I don't think that we do as social or civil society or patient organisations unconsciously spread stigma. I don't think we do, because I think the whole thing about stigma is it's about information, you know, and what we proactively do is provide, number one, support, peer support. You know, I'm a really big advocate for peer support. We employ over 130 people to deliver peer support, who are people with lived experience. It works. But it's about providing information, raising awareness, like, you know, in terms of healthcare, you know, making sure the right information is there. We go and we train healthcare providers. We should tell them what it's like as somebody with lived experience to go through the journey of and it actually changes the healthcare workers' perception. It's like, oh, you know, and the feedback generally is, actually, I understand my clients or my patients better, so they find it easier to work with them because they have a different understanding. So I think, you know, what we do as community civil society organisations is we raise awareness. So I'm going to take a risk and say, I actually think that we don't spread stigma. I think that we are doing our utmost to dispel stigma, because part of dispelling stigma is raising awareness and providing education. And that is what we're doing. So, you know, we have this whole thing of what the support we need and the self-stigma, but externally, we are raising awareness and trying to dispel it. So, and I think it's really important to note, it is very different in in different countries. You know, I am privileged to live in high-income country where we have laws that protect people and protect discrimination. There are other countries that, and some of them I know are on the call today, there is no protection and there is no support. You know, and it's different wherever you go, and we need to acknowledge that it's very different across the world. I think we've got a little bit of time left because I know that Steve is desperate to come in and do a little bit, just a little bit, Steve, on language. This is something that's come up also.
Desperate to jump in, yeah. Hello, everybody. So I'm the Communications and Marketing Manager with World Hepatitis Alliance, and Lardith's question was really interesting for me to see come through. I'm someone who doesn't have lived experience, and I'm working in a communications role around hepatitis. So that means that I have to be very careful and care in terms of the word care, not just careful as in worrying, but actually communicating care and understanding the language that should be used to communicate things around hepatitis and, in fact, all communicable diseases, because, as has been mentioned, there's this potential concern people might have of kind of pitting one thing against another, which isn't the intention. But I think this is where, as Karen said, that there are people that care, and as Chester has said about peer support groups, and as Rachel has said as well about having groups of people with lived experience providing training to people who don't necessarily have that experience but do care and do want to help. I think this is a big evolving aspect of breaking down stigma. What is the language that we should all be using? What is helpful, what is unhelpful? And I think I'd be curious to know from our guests and from anybody who has tuned in, any particular things that they've found in their work that has been particularly helpful when talking about hepatitis, the language of hepatitis, the language of lived experience, and keeping that channel open so that we can continue to evolve how we talk about it as both the World Hepatitis Alliance and all these other organizations who are all working towards the same goals.
I think that's a great question, Steve. I think that's I don't think we often talk about it either. Interesting, really interesting. So I'm going to put it out to the audience as well as our guests here. Karen, your mic's off. Are you ready to jump in?
Well, you know, as again, back to my teaching experience, working with high school students with a variety of backgrounds, and I use simple acronyms. One of the acronyms I really love is LEAP. And so it's like, no matter what a student's going through, listen, empathize, accept, just agree with them, and then partner. You can diffuse any situation. You can help a non-reader to graduate from high school by finding out what his strengths are. So I think I like to use acronyms. And so I think when we're looking at training, I helped start TRIO Oklahoma, Transplant Recipients International. We have a chapter in Oklahoma where we sit in small groups every week and help transplant patients or people who are waiting. But I think this goes across the board. So and I also have a respectful guidelines that would hang on my classroom door. So, you know, if you're wanting to develop some curriculum, Steve, I'm ready for this about how to communicate, because that's my gig, is that if we can't hear each other and if we can't just accept, not always agree, but accept and empathize with each other, then we can partner. Now we've got that one-on-one that Chester and Supa were talking about, or that small group of trust.
Fantastic. Chester, what about you? What about language? What would help, or what language would you use, or do you use?
Okay, thank you very much. So what we do within the safe space that we usually form within the community, first of all, we have what we call the consent forms, where we make sure that each and every person who is in that space is able to sign, so that I see there's confidentiality and trust within the space. So at the end of the day, again, in terms of language, we do make sure that at least we engage the community so that we can be able to communicate in local languages, so that a person can be able to understand, and also to make sure that at least we don't discriminate or stigmatize anyone with their lived experience or living with hepatitis. So we make sure that at least we do guide them, we do trainings in terms of language, how to communicate, how to pronounce this and that, so that at least we are very, very sensitive, because this is a sensitive community at the end of the day. So we need to make sure that at least whoever we engage is fully aware, so that he or she, when carrying out duties in terms of conducting sessions and everything, is able to carry in full in terms of understanding each and every aspect of hepatitis.
Fantastic, fantastic. Supa, anything for you around language?
I mean, Karen and Chester seem to have covered it all, but
I do, yeah.
but for us, one thing I do practice when I speak with other people with lived experience is that you just have to be empathetic to their journey. Everyone, and I say this quite a lot, everyone's journey with hepatitis is different, but there's going to be similarities, there's going to be commonalities between all our journeys. The one thing, and I make this a key with an organization to not ask, is don't ask how they contracted it. It's one of those things where it doesn't matter at this point now. It's about living with it. And ultimately, if it causes more stigma, if it causes more pain, trauma, to ask them how they got it, we don't want to know. But if they want to talk about it, if they want to find some closure around it, that's somewhere we'll be happy to listen to.
Fantastic, fantastic, really well said. Can I just throw one in as well? So there is, I write for funding applications or in the language that we use, and rather than saying somebody has hepatitis B or hepatitis C or whatever is, I've started using affected by. Because what happens is if somebody stands there and they become. If you say they're affected by, it changes the power. And I'm beginning to see it more in other written documents now, affected by rather than has. You know, because and I think there's something quite empowering about that. I think we see it, you know, with the people in prison. So instead of using the word prisoner or inmate, you say a person or people in prison, because then they aren't labelled. It's about labels and stereotypes, which also feed into stigma and discrimination. This could get very complicated, I know, but I think it's worthwhile, because you take the power out of the word. Words are very powerful. We know from our own lived experience how powerful the impact of words can be. And actually, if we're careful, we can take the power out of them. So, I don't know if anyone's come across that, but I actually really like, I actually use affected by all the time now instead of has or had, because then they aren't, they're not I want to say, no, anyway, yeah, Steve, I saw it come on.
No, it's great. So yeah, this is exactly what I think is inspiring about having these kinds of forums and these opportunities, and to learn from peer support groups, is that language evolves over time. We obviously work to a set of guidelines with how we talk about the people that we meet through our work. But that can't stay static. That needs to keep on evolving as the landscape changes and as people understand it, certain things are potentially stigmatizing. And so, yeah, we just want to keep those channels open. So thank you so much for contributing your thoughts on that. If anybody ever wants to talk to me further about this, I'd love to hear it. And I believe Patricia had her hand up as well.
Yeah, I've just seen Patricia's got a question. Hi, Patricia. Patricia, are you there? Let's just see. Ben, is Patricia unmuted?
I'm just waiting for her to unmute the mic.
Is this our Patricia?
It is.
Oh, how lovely. Sorry, everybody. I mean, there's a whole load of people on the... Patricia used to sit on the World Hepatitis Alliance board, and it's been a little while since I've seen her. So it would be lovely to hear from her.
Doesn't look like the
no,
is playing ball today.
Okay. Maybe if you can't get the
I'll talk to her on the side, Rachel, and see if I can get
okay, because I think we're getting closer to the end. We've got 10 minutes left. And it's very unusually a very quiet audience. Normally, we have loads.
Edson now, Rachel, actually.
Sorry?
We do have Edson.
¿Me escuchan?
Hello. Oh, hello. Hi.
Sí, hola. Voy a hablar en español. Voy a hablar en español. Voy manejando, por eso me costó un poco activar mi audio. Me alegro mucho en este webinar, está interesante y sí considero que una de las cosas más importantes es saber ir evolucionando la forma en que damos los mensajes. Como dice Raquel Recher, tenemos que hablar de las hepatitis, hablar cómo se transmiten, hablar cuáles se transmiten más de una forma que de otra para alertar a la población y que eviten riesgos. No para estigmatizar, porque el estigma viene del desconocimiento. Entonces, nosotros no debemos tener miedo de hablar de las hepatitis, de cómo se transmiten, qué manifestaciones dan, qué tipo de protección se debe dar, porque si no, estamos callando. Entonces, voy a poner un ejemplo. Cuando tenemos un paciente con hepatitis B, afectado, hepatitis B, como decía Rachel, debemos decirle que la familia o el grupo que vive en la casa debe vacunarse si es que no tiene vacuna. En países como Guatemala y muchos países en desarrollo, no todos tienen vacuna de hepatitis B. Entonces, el núcleo familiar debe ser vacunado. Y ahí no estamos estigmatizando a la persona afectada. Estamos previniendo que hayan más afectados. Entonces, es muy importante que nosotros estemos muy claros cómo abordar para no estigmatizar, pero cómo abordar para tampoco callar las hepatitis. Eso quería decir. Muchas gracias.
Thank you so much, Patricia. And I do hope you're on loudspeaker in your car while you're driving. Thank you. Any comments from our guests on Patricia's question? Well, it was a question, it was a statement really, and I absolutely agree. Supa?
I completely agree. When it comes to hepatitis B, you do have to test the rest of the family, but for the person who is affected by or living with the condition, it can be really, really tough on them. And ultimately, they would have to put through that balance of, do I tell the rest of my family I have it to get them tested, to get them vaccinated, or do I stay in silent because I don't want to share my condition as of yet? And it is very, very, very tough on the person, but I'm always a proponent of like pushing to talk about it, because the more you talk about it, the more you realize it actually helps get rid of the stigma as well.
Yeah, 100% agree. We've got 6 minutes left. There is, if everyone's got access to the chat, there is Adi Kuhn. Is it Adi Kunli? Adi Kunli, sorry, that has put a message in around, and it's a really lovely breakdown around stigma surrounding hepatitis and the impacts psychologically. And I think it's very much things we've spoken about, the anxiety and the depression, the shame and the guilt, social isolation, and then the barriers to healthcare. It's really well written there. So if you have and the effects on daily life. So if you've got an opportunity to read that, please do read it before we finish. Edison, just got time for one more question. Is you put your mic on? Ben, can you put Edison's mic on, please?
Hola, hola. Buenos
Hola.
días. ¿Me
Buenos
escuchan?
días. Good morning.
Good
Hola.
morning.
Hola. Hola, hola, buenos días. ¿Me escuchan?
Yes, we can hear you.
Ah, perfecto. Muchas gracias. Bueno, realmente muy interesante todo el panel, los comentarios que han vertido cada una de las personas que han intervenido y me alegra mucho la, el debate, ¿no? El debate, el intercambio de ideas que ha generado la pregunta del audit, el comentario del audit, ¿no? Porque sí, definitivamente tenemos que comunicar, tenemos que ser muy claros, muy precisos al comunicar, no debemos censurarnos para comunicar, pero sí, hay una línea muy delgada, como dice el audit, porque quizás muchas veces con la intención de que se llame la atención, que se priorice más las hepatitis, hemos puesto el foco en hacer el paralelo con VIH y con tuberculosis, ¿no? También hemos aumentado la malaria muchas veces, pero digamos, sobre todo el VIH y la tuberculosis son enfermedades que, bueno, al menos en esta parte de la región de Latinoamérica, son muy estigmatizadas. Entonces, sí creo que hay que seguir hablando de la enfermedad, hay que ser muy precisos. Quizás el énfasis que ponemos en que mira, produce más casos que el VIH y la tuberculosis juntos, ¿no? Quizás podemos manejar mejor esa parte y ser muy claros en que son enfermedades que si bien pueden ser contagiosas, pero que también se pueden prevenir en algunos casos, en muchos casos, ya con las medidas de cuidado, no solamente la vacunación al caso de hepatitis B, lamentablemente todavía no hay una vacuna contra la hepatitis C, pero sí creo que repensar los mensajes para no aumentar el estigma sin que sea esa nuestra intención es una buena idea a considerar. Muchas gracias.
Thank you, Edison. And I think that we should never not speak. We should never be afraid because of the stigma that exists, you know, whether it's HIV, TB, and viral hepatitis being so. We should never, ever be afraid to speak out, irrespective of what we think the view is out there. I think we have to be bold and we have to be brave and we have to continue to communicate because it really is about education. So before we finish, we've got 2 minutes. One quick last word from you, Supa. Anything?
Put me on the spot. Right. The theme this year, let's break it down. We've been, as a person living with hepatitis B, we've been in the shadows for a very, very, very long time. It's now time. Let's come out. Let's start doing our thing. Let's start really talking about it. And who knows, maybe next year we might actually have a step closer development into a cure.
Fantastic. Good on the spot. Karen, last words?
So that was wonderful and broad. So I'm going to come in on detail and I'm going to say to everyone that's in this audience, go clone yourself. Find someone in your office, someone in your clinic. You're here, you care, you're learning about it, you're teaching others. So go clone yourself so that by this time next year, I'll agree with Supa, there'll be more people like you, because it's our clinicians, it's our doctors, it's our researchers, it's our people who are sitting in the waiting room helping us fill out the forms. You're our heroes, you're our lifesavers, and thank you for being here today.
Fantastic. Thank you, Karen. And Chester?
Thank you very much. So for my last word is let's break it down to the grassroots level, the community itself, so that at least we can have those social groups, those movements at grassroots level, so that we can have lived experience people to take lead in this fight that we are fighting, so that at least from the grassroots level to the national level and global level, we can champion stigma of hepatitis. Thank you very much.
Ah, amazing. Thank you all so much for joining us, Supa, Karen and Chester. Thank you, everybody that's taken the time out of their morning, day, afternoon to join us as well. And I think there is a global webinar on Monday, depending on where you live, 1:30 to 3. Hopefully you can adjust that according to where you are in the time zone that you're in. But I guess the final message from me is nobody, absolutely nobody needs to die from viral hepatitis. We have a vaccine, we have a cure. Let's break it down, let's stop the stigma, and happy World Hepatitis Day. You know, and we don't have to do this just because it's World Hepatitis Day. We can keep doing this every day. So thank you once again for joining us. Amazing, amazing webinar. Thank you. Thank you very much. Bye-bye.